I'm Brian Donley, an orthopedic surgeon at the Cleveland Clinic. Ankle sprains are one of the most common injuries that occur in all of sports. The symptoms of an ankle sprain are most often pain and swelling on the outside part of the ankle. For treatment, just remember the word RICE. Rest, ice, compression, and elevation. If you don't get improvement using this method, you should consult with your doctor to make sure it's not something more serious.
That's good advice. Thanks for that. Welcome back. When a football player walks onto the field, there are certain things he needs to play the game. Helmet and shoulder pads are a good start. Hip pads and cleats are also essential. But there's something every football player has to have that you won't find in an equipment room or in a locker. It's between the ears. Football is a game filled with big hits, big runs, and lots of emotion. But that emotion will only get you so far when your team needs you the most. Dr. Michael McKee is a psychologist at Cleveland Clinic. He says the one intangible every football player must have to be successful is confidence.
It's easier to sabotage yourself than it is to build yourself up.
Confidence is believing you'll act in a proper or effective way, and you're not going to find it in the weight room or in the end zone. Dr. McKee says it's gotta come from you.
It's a great mental game. You can't do it just on sheer physical ability.
Dr. McKee says one of the best ways to build confidence is to set goals.
And they want to be performance goals, because you can control performance. You can control what you do. And you make them short-term goals when you're in the game. On this play, what I'm supposed to do is block that linebacker.
Then, after the game, think about what you did right.
Take 10 to 15 minutes and go through some visual imagery of what you've done well in the past and what you plan to do well in the future.
And you'll be confident knowing you've done a good job, win or lose. Dr. McKee says these techniques don't apply only to football. He says you can use them to build confidence in almost anything you do. Soccer players typically spend a lot of time in the gym strengthening their lower bodies. But it takes more than just leg lifts and squats to remain on top of your game. So there's a soccer-specific program offered at Cleveland Clinic's Sports Health Facility called MatchFit. It's not only for the athlete who wants to play better, but also for those who want to get better.
This is gonna be hard.
To warm up, we'll do some jumping, we'll do some speed stuff.
MatchFit is a performance program and it's an injury prevention program. It's a soccer-specific program, making you faster, stronger, more agile, that kind of stuff. We've seen grade school kids to high school athletes, and we've had college and professional athletes.
I had surgery and I noticed that my knee started to get a little weaker, so I talked to Carol and she said to come in and try and strengthen it. Working on strengthening different muscles in my legs and more like planting my feet to make sure I'm doing it right so it doesn't mess up my knees anymore.
So really knee deep, turn your knee out. Good.
You strengthen your core, so if you jump up, you don't land bad and you don't hurt your knee.
Every person that comes through the program has an individual evaluation where I look at core strength, I look at how they're cutting and landing. We do a video analysis of them jumping and their squatting form, those kinds of things. In the video analysis, if somebody's knee, the ratio of their knee distance to their hip distance, if it's 60% or less, then they're landing within proper form. And we show the athlete too, so it's kind of cool for them to see, slow down frame by frame. We'll videotape them at the end and they can compare themselves and see how much different form they're using.
It was actually recommended to us by someone on his soccer club. They felt that it was just a good way to improve his abilities, improve his strengths. Usually every other day we're taking home exercises from here and then he's doing them at home. So every other day he's doing a workout either here or at home.
In a perfect world, everybody would be doing this kind of stuff in practice from a young age, and they would have the foundation, and we wouldn't be starting from scratch at 17 years old. I'm a believer in the earlier you can teach people the proper technique, the better off they're going to be down the line, the less prone to injury they're going to be.
Prices vary, but you might pay as little as $25 a session. For more information on the MatchFit program, visit our website, clevelandclinic.org/sportshealthshow. Coming up, a group of Little Leaguers get some big league information on sports health. Pulled muscles are common in any sport, but what's the best way to treat them? A sports injury expert helps us to ease the pain. But next,
I'm Chris Jimenez, catcher for the Cleveland Indians. Coming up after the break, I'm going to show you how to get an active warm-up in that you can do before any game you play.
Discover the very latest in vascular technology, found at only 10 hospitals in the nation. Discover trusted birthing care and life-saving advancements in women's imaging. Discover trusted emergency and intensive care, all within a Cleveland Clinic hospital, just off Interstate 480. People in your community are discovering the great care that's come to life at Marymount Hospital. Discover what's inside for you.